So as we say, Care for the Family are hosting, but this webinar is actually the webinar of the Family Hubs Network. And so I'm delighted now to introduce you to Catherine Barker, who's Head of Development at Family Hubs Network. And she's going to unpack all about Family Hubs, how they've come about, and also what that means for the church. Catherine, lovely to see you.
Thank you, Paula, and thank you, Robin. We are so grateful to Care for the Family for hosting today's webinar and giving us this great opportunity to talk to so many of you about Family Hubs. So first off, I'll give you a few words about the Family Hubs Network, because you probably haven't heard of us, but you may well have heard of Samantha Callan. She is, as well as co-founder of the Family Hubs Network, she's also a trustee of Care for the Family, and she's parliamentary advisor to Lord Farmer. Together, Samantha and Lord Farmer have worked tirelessly to develop policy at national and local level to ensure families, and particularly vulnerable and disadvantaged families, have better lives. To do this, families need the right help at the right time to get through challenges and have better outcomes and a better future. So I'm going to start by telling you a little bit about the history here. Family Hubs are at the heart of this mission because they bring together people, places and services in a community to work together to help families in need. Samantha and Lord Farmer founded the Family Hubs Network to campaign for this approach to become government policy so that every community has a family hub. So to cut a long political story very short, at the end of 2020, while interestingly we were still in the depths of the pandemic, the Department of Education announced that a Family Hubs policy would be rolled out across England. Next slide, please. It's interesting because the pandemic actually played an unexpected part. I expect everyone on this webinar is aware that many churches stepped up during this challenging time. They reached out, cared, helped, they made a difference. And churches have demonstrated in the last 18 months, beyond any shred of doubt, that their role in the community is needed and that they can make a massive difference. At the same time, those working in local authorities were under a lot of pressure. Overnight, the services they knew many families relied on shut down. They couldn't reach vulnerable families. They felt completely helpless. But like so many churches, many local authorities began to think creatively. They reached out in new ways and forged new relationships to ensure that vulnerable families got what they needed. As one local authority employee put it, "We tore up the rule book. Why would we go back?" So in that sense, the pandemic was liberating, and we have the opportunity now to build on those new partnerships, that new way of working. Perhaps you're keen to build on what your church has achieved, or perhaps you're feeling exhausted. Perhaps you're here because you feel you should be rather than you really want to be. If that's the case, I really hope we can inspire you today. So what does that experience in the pandemic have to do with Family Hubs? Family Hubs at their heart are about partnership, about working together to achieve shared goals. So right now there are 152 local authority areas in England where staff are either running Family Hubs already or developing them. It's a new beginning for how we look after families in our communities, and churches have a really crucial role to play. Next slide, please. Family Hubs, in a nutshell, they are networks of people and places within a community working together to reach and support families who need help. Families can access help at Family Hubs, which can come in all shapes and sizes. As you can see on this chart, they can include public buildings such as converted children's centres, buildings within school grounds or libraries, and buildings run by the voluntary sector, such as churches, mosques and community halls. What they have in common is easy access, a warm welcome from staff who know not only about what's available in the hub, but have an extensive knowledge of the other people and places in that network, in the community. Within the network are other places which are not delivering the same high level of access, staffing and detailed knowledge, but are equally important because of what they offer to families in terms of activities, relationship and support, and therefore playing an absolutely essential part of the network. The connectedness is key, and ensuring that churches are part of these networks is one of the main reasons we're here today. Slide 4. Connectedness is just the start though. Working to a family hub model is about applying 9 principles, which I think, to be honest, will make a lot of common sense to churches. The first 3 are implicit in what I've said already. 1, access. 2, early help. 3, for all families. When we say early help, what we mean is helping families when problems emerge to solve them, or at least stopping things getting worse. It's about prevention, as Robin was saying earlier. All of us who are passionate about helping children have the best life chances know that early help can make a huge difference. And all 9 principles contribute to ensuring that families get the right help in the right way at the right time. For many vulnerable families, raising children is challenging from the very get-go. So early years support from conception up to 5 is an absolute must. But every parent needs to be able to access help and support. This spans from the essential health services like antenatal care and baby checks through to parenting support, so activities for babies and preschoolers, parenting programs, childcare, to addressing families' wider needs, including employment, training and welfare support. Which brings me to the next principle, a relational culture. And this one is so big as to why churches need to be involved, because churches get this. When families are distressed, they need to be able to access help really easily and comfortably. Family hubs are about a relational culture where the people in the hub are focused on being welcoming, ready to engage, and not being done with that person until they're sure they're being safely supported. Often that's about being very aware that the presenting problem may not be the core problem. It may be that mum turns up and says, I'm really struggling with my 8-year-old. And one might think, right, great, we'll get them on a parenting course. But it's not that. It's about talking a bit more and finding out that mum's recently separated from her partner or lost her job or is experiencing depression. By taking this more relational approach, families can get the right help and be helped to access it with warm referrals. By that I mean such as making a phone call on someone's behalf or actually going with them to the place where they can get the help they need, not just signposting. You'll notice I mentioned a relationship crisis in that scenario. Apart from early years support, relationship support is the only service we specify in the principles of family hubs because it's so very important. Often relationship conflict or unhappiness is central to a family's problems, and yet those around the family can be reluctant to raise the subject and suggest couple relationship support. And yet, if we don't help a couple to improve their relationship, or if separated, co-parent better, then the negative impact upon children will continue and other problems are more likely to arise. To normalise and champion couple relationship support, those working with families need to be proactive and talk about it with empathy and confidence. A whole family approach is the next principle, and it makes sense following on from what I've said. Struggling families often face multiple challenges, and we need to support the whole family in a holistic way, rather than address a list of problems intervention by intervention. Working together in an integrated way is the glue which ensures that organisations work well together to ensure that all families get a seamless, fully empathetic and non-stigmatising experience. This means sharing information and shared goals. While local authorities can internally work more efficiently to this end, their and our ambitions to help families can only really be fulfilled if the voluntary sector and community is included. So looking across those principles, we can see exactly why churches have such a strong role to play. Reaching and supporting families is, for many, core to their mission. They're welcoming, relational, non-stigmatising, they cherish relationship, and they seek to be at the heart of their community. Let's quickly go to slide 5, just to show that when we talk about what goes on within a family hub network, it's all sorts of things, from specialist interventions to more everyday services, which are just as important in building relationships with families to give them that support. And I hope that when you think about the kind of things that I've got pictured here, there's something there that your church is probably doing already. There are probably some more specialist interventions, more demanding ministries that you might be thinking about doing. But the point is, every church has a role to play. So, next slide. What next? Family hub networks of support are being developed everywhere, and we're really serious about reaching vulnerable families, building relationships with them, making them stronger, and helping them have the best life chances. And churches need to be involved from the get-go. This afternoon, you're going to be hearing from those who have stepped up in their engagement with their local authorities, developed family hubs, and had a great impact on families. They are truly inspiring, and I think they will do a good job of bringing family hubs to life. And can I remind you, please put your questions for the panel in the chat so that we can either answer them later or after this event, as we want to make sure that everyone gets as much from this as possible. Thank you.